October is Sudden Cardiac Arrest Awareness Month. To raise and promote awareness for both medical professionals and the communities they serve, we've assembled a group of amazing educators to speak on a few in-depth topics related to this. We'll take a look at some high-yield information and hopefully provide answers to a lot of common questions. Some of these will include: what is sudden cardiac arrest or sudden cardiac death? What are some of the causes and risk factors? Sudden cardiac arrest versus heart attack. How are they different? What are some of the respective symptoms that may precede, and what are the appropriate actions? We'll talk about the association with things like long QT syndrome and other genetic predispositions. We want to look at the use of CPR, AEDs, some psychosocial aspects that are associated, and of course, the goal of this entire project, which is to culminate with healthcare and community education. So let's go ahead and jump in.
October is Sudden Cardiac Arrest Awareness Month and serves as a time to recognize some of the great work that's being done in this area. Here are some facts. Sudden cardiac arrest is an emergency in which your heart stops beating suddenly. It is caused by an electrical problem that leaves myocardial cells without oxygen, and without prompt treatment within minutes, sometimes seconds, it is universally fatal. Now, sudden cardiac death is the largest cause of death in the United States, accounting for approximately 325,000 adult deaths annually and responsible for 1/2 of all heart disease-related deaths, with a peak age group in their 30s and 40s. Now, coronary artery disease accounts for most cases of sudden cardiac death, approximately 80%, with the most common arrhythmia being, you got it, ventricular fibrillation. Systems development, training, education in the pre-hospital setting is vital in treating sudden cardiac arrest because, remember, 1/3 of all patients who have a cardiac arrest outside the hospital don't make it to the ER. And finally, remember that frontline care for managing sudden cardiac arrest in the form of CPR has only been formally recognized and endorsed for the past 60 years or so. So I invite you to be part of this journey of learning, educating, training to reduce the rate of this dreadful disease.